Hi, this is Brian Kim. I'm going to share with you case number 24 in the best way to do cataract surgery series. This is a 1 to 2 plus dense lens, and I'm going to show you my very careful and systematic lens disassembly using double chop, cross chop, and mechanical fracturing. I want to convince you that using the chopper to prolapse pieces out of the bag, using mechanical fracturing forces to crush the lens piece between the chopper and the phaco tip, this increases efficiency, increases safety, and reduces ultrasonic energy. And in my mind, this is the best way to do cataract surgery. I use a corneal mark to help me center and size my rhexis. I make my paracentesis incisions. I start inferiorly first. I like to use a cotton tip to help me gently manipulate the eye. In this case, I'm going to rotate the eye down so I can have a flat approach. You want to make sure that the blade is parallel to the iris plane by creating that corneal shelf. This helps to achieve a self-sealing corneal incision. I inject intracameral lidocaine and then dispersive viscoelastic. I use a cannula to help hold the eye for my triplanar corneal incision. I make a vertical groove and then place the blade into the groove, tunnel through the cornea, and then dive down and enter the anterior chamber. And this is a very robust triplanar corneal incision. I then begin my capsulorhexis. I do a puncture-style rhexis, puncture to the center, pull downward, and then I'm grabbing and re-grabbing to create a small flap. Once I get a nice flap, I start to go around circumferentially, and I'm trying to follow my corneal marks, which will help me to center and size my rhexis. You can see I'm grabbing and re-grabbing, making sure I'm not turning the eye, torquing the eye, and I'm not putting any undue stress on the wound, which will cause viscoelastic egress and cause the rhexis to become more unstable as I do so. I burp some viscoelastic out of the eye when I'm done, and then I begin my Capsulorhexis hydrodissection technique. Place the cannula out to the equator underneath the anterior capsulorhexis edge, turn the cannula tip down. I get a nice fluid wave. You can see that propagate nicely. I decompress on the left side, and then I start to spin the lens on the right side. And in this case, the lens spins without much effort. And then I begin the phaco. I like to irrigate the surface, and this helps clear any bubbles in the tubing. I lift the incision with my chopper with irrigation off to minimize Descemet's trauma. I remove the surface epinuclear material, and this is going to be my reference point. I'm going to go underneath, start the chopper out centrally, go underneath the epinuclear ridge, place the chopper out to the equator, turn the phaco tip vertically, subincisionally, get into the meat of the lens, crush the lens in half, and this is the double chop maneuver. Place the chopper out to the contralateral equator, and then I bring the chopper essentially to meet the phaco tip, and this crushes the right heminucleus. I place the chopper out to the equator again, and I'm crushing that first quadrant, and I do that again to prolapse the pieces out of the bag. I'm using successive mechanical fracturing forces to crush the lens material into smaller bite-sized pieces, and using high vacuum to remove the lens pieces. As needed, I will use a little bit of ultrasonic energy to clear the tip and also to help emulsify the lens pieces. I'm going to use a chopper to prolapse the second quadrant out of the bag, and then using the vacuum to help manipulate the lens into position. And then I start crushing the lens pieces into smaller bite-sized pieces, again using high vacuum and mechanical fracturing forces to remove the lens pieces. I rotate the last and second heminucleus in front of me, place the chopper out underneath the epinuclear ridge, out to the equator. I bring the chopper tip centrally, and I place the phaco tip deep in the bag, and this sandwiches and crushes that second heminucleus in half. I use mechanical fracturing forces that sandwich and crush that third heminucleus into smaller bite-sized pieces, and using high vacuum to evacuate that lens material. This is the last quadrant. I'm placing the chopper out to the equator, placing the phaco tip deep, crushing that fourth quadrant in half, and then using mechanical fracturing forces to crush the lens pieces into smaller bite-sized pieces. And this is the end of the lens disassembly. I use a phaco tip to remove my epinuclear shell. I like to always keep the chopper deep in the bag. This helps maintain and protect the posterior capsule from the phaco tip. I use the chopper to manipulate the epinuclear material up and away from the posterior capsule, and this safely helps me remove and loosen up the epinucleus, as well as keeping that posterior capsule back. It is my opinion and a good habit to always place the chopper deep in the bag when removing the last pieces of epinuclear material or endonuclear material with a phaco tip. The chopper is ideal for this. You don't have to switch instruments. It's long and it's smooth, and it does a great job protecting the posterior capsule. I push BSS into the eye as I pull out the phaco tip, and then switch to the INA. This is my way to maintain the anterior chamber as I switch instruments. I'm going underneath the anterior capsulorhexis edge and beginning the INA. You can see that this bag is fairly clean. I want to be very gentle as I go underneath the anterior capsular surface. You don't want to accidentally snag the capsule and cause any zonular stress. I'm polishing underneath the anterior capsulorhexis edge first, and then once that's fairly clean, I switch to the polish mode, and I'm going underneath the anterior capsulorhexis edge, as well as polishing the posterior capsule. You can see it's fairly clean, except there's some cortex in the subincisional space attached to the posterior capsule. So I'm using the polymer tip, which is very safe, and I'm liberating this cortical material from the posterior capsule surface. I'm using the BSS cannula to pulse BSS into the capsular fornix subincisionally. This helps to loosen and liberate that cortical material within the subincisional space. This is a little bit of a tricky technique, so I wouldn't really recommend doing this unless you feel very confident in your hand control. Despite using the cannula to help pulse the subincisional capsular fornix, you can see there's some wisps still there, but that's okay. I loosened it up and I plan to attack it again using the capsule sweep. I take the BSS cannula out and then inject cohesive viscoelastic into the bag, and then I use the capsule sweep to help sweep underneath the anterior capsulorhexis edge. I'm using the sweep to gently polish the anterior capsular surface, as well as try to remove any potential lens material or cortical material. I do the same thing on the other side, polishing underneath the right side, and then now I'm ready for my lens injection. Using that sweep to hold the eye, I inject the single piece acrylic intraocular lens into the capsular bag. And then I'm going to place my INA handpiece with irrigation off, and I try to separate each haptic from the optic surface to make sure they're detached completely. And then I go underneath the lens. I rotate the lens 90 degrees clockwise, and I tilt the lens so that I'm sure that the lens is into the capsular fornix. This ensures that both haptics are in the bag, and I'm also able to remove any of the viscoelastic from underneath the lens. I go ahead and polish a little bit more underneath the anterior capsulorhexis edge, and then remove the viscoelastic from the anterior chamber. And I'm trying to make sure that the bag is completely clean, and that's why you see me teasing the lens away and aside as I'm trying to remove any small amounts of lens material. I'm very compulsive about making sure that that bag is completely clean of any viscoelastic and any lens material. I remove the viscoelastic from the anterior chamber, and then I push BSS to keep the chamber stable, pull the INA handpiece out, and then I hydrate my incisions. So this is, again, a 1 to 2 plus dense lens, and you saw double chop, cross chop, mechanical fracturing. This is a very careful, easy, methodical way and a systematic way of lens disassembly. You can do this technique without having to spin the lens in the bag. This is a very zonular friendly technique, minimal use of ultrasonic energy, very controlled, easy prolapsing of lens pieces out of the bag using the chopper, leveraging mechanical fracturing forces, and using the chopper to pull pieces out of the bag. Minimizing ultrasonic energy and vacuum provides clearer corneas and a simpler and more direct way and safer way to disassemble the lens. If the surgeon can overcome the fear and intimidation of placing the chopper out to the equator, I believe this is the safest and most efficient way to do lens disassembly. I hope this was helpful to you. Please like and subscribe, and I thank you for your attention.